Hey guys, Dr. Ritza here, downtown Toronto chiropractor, acupuncture provider, and manual therapist, coming to you from the King West Club in downtown Toronto. So what we're going to be talking about today, guys, is hip strength. Specifically, we're going to be going through a hip strengthening protocol that was developed by this awesome researcher, Chris Powers, at the University of California in Los Angeles, UCLA. Chris Powers is kind of a knee guru. A lot of his research focuses on patellofemoral pain syndrome, and this is for what this hip strengthening protocol was developed for. But it's amazing also for working on managing core strength, low back pain, IT band contracture syndrome, glute med or glute min irritation, or greater trochanteric pain syndrome. Any of these conditions, this protocol works amazing for, and we're going to go through it now. All you need for this is some gym attire, a TheraBand or a resistance band, and about 5 or 6 minutes each day. This protocol is step one of many steps, and when you go through step one and can graduate from it, we bring you up to level 2, which we'll bring to you later. For all of these exercises, which include the fire hydrant, side bridge, a couple of side bridge modifications, and a clamshell and its modification, you're going to do work on 1-minute holds of each position with the resistance band, and when you're able to get up to those 1-minute holds, then you graduate on to level 2. If any of them hurt at any point, obviously you want to stop and let your manual practitioner know, and we can find some sort of alternative exercise for you. But fantastic exercises to work on for any of those conditions that bother you, and an amazing exercise if you suffer from patellofemoral pain syndrome or any knee pain. So with our first exercise in the hip strengthening protocol, it's the fire hydrant. So the fire hydrant is going to be an exercise where we're going to be on all fours on a cushion mat or a table, and we're going to work on lifting our leg out to the right like a dog would use to go to the bathroom on a fire hydrant. We want to make sure that we're not lifting the leg forward like I just demonstrated, but rather maintaining a nice stable body position and lifting the leg backwards and holding that position for about 1 minute or as long as you can hold it. What we do is we take our TheraBand, which is looped and tied at one end, we wrap it around the thighs, just below the knees, and so with this we're going to do a regular side bridge, work on holding for a minute, and we're going to add in a clamshell and a leg extension while we do the side bridge. So just as a refresher, we get into our side bridge position just on the knees, ear to knee are lined up nicely in line, and we would hold this working for 1 minute. Next, after we've taken a small little break, we come back up into side bridge and we're going to add in a clamshell. So the clamshell is when the feet stay together and the knees separate against our resistance band. We want to make sure that we're maintaining that good glute activation and also good activation in the core. And again, we'll progress to holding this for 1 minute, do it on both sides, take a break. The next exercise that we're going to do is the side bridge. We're going to add in a hip extension and leg abduction. So the leg comes straight out and up. And what we'll do, and what you'll see from the side profile, is I'm mainly just activating the glute min and glute med. And I know I'm doing that because the leg is slightly behind the midline of the body. We maintain that good core activation and glute activation and work on holding that for 1 minute. So here's our side profile for our side bridge progression that we've been working on, guys. You can see that nice alignment, just like the other side bridge video, from the ear, the shoulder, the hip, and the knee, nicely aligned. You can see the pelvis is not sitting back, which means that the glutes are not activated. They're nice and tight, holding that coin between the buttock muscle, which is our Q, and then also maintaining that nice core activation on the side. And then when we go on to do either the clamshell, where my left knee is raising off my right, I don't change my body position at all. And the same thing when we go to do that leg extension. This is the one thing I really wanted to highlight, where the leg is not in front of the body, which would activate more of the TFL, but rather out and towards the back, where we know that gluteus minimus and gluteus medius are working really hard to hold that up, which is okay, guys, so this is the bird dog. What the bird dog is, you're going to be on all fours on a nice cushy surface such as a mat or carpet at home, and you're going to be on your hands and on your knees. You want to make sure that your wrists are beneath your shoulders and the knees are beneath the hips. You want to have a small little dip in the low back, such that you could support a glass of water on the low back, and that the low back isn't going to move, so the glass of water would stay there throughout the exercise. You also want to make sure that you have a nice core contraction, always using that abdominal brace that we've worked on. What we're going to do is we're going to use at first a single arm movement and a single leg movement, and eventually progress to using the arms and the legs at the same time. Another fantastic cue for the bird dog is you want to make sure that while the chin is tucked, you also want to breathe nice and easy, and make sure that when the arms and the legs move, pretend that they're following along a train track and that they can't deviate from them, so that they're going on two straight lines in line with the shoulders and the hips. So for the bird dog, we're going to demonstrate just that. We get on our hands and knees. You can see my hands are beneath my shoulders, my knees beneath the hips. I don't have a huge hollow in the low back, and there's not a round in the low back. It's nice and flat. If I were to touch my tummy, it's tight, and my chin is nicely tucked. And so what we're going to work on first is just maintaining that brace while we slowly raise up the arm, which is going to work on strengthening the thoracic paraspinals as well as the shoulder, and bring it back down. You can work on bringing the arm up next, the opposite arm, on about a 1 or 2 seconds up and 1 or 2 seconds down. And what's really important is you notice that my body doesn't shift throughout the movement, and if I had a glass of water in my low back, it would stay there. So when we go on to moving the legs back, we want to make sure that the legs move slowly along the ground, along that imaginary train track, and that we're going to work on not overextending the back, but rather trying to engage the glutes at the end of the movement. So what that's going to look like is that left leg is going to come back slowly and about to parallel. You notice that my trunk doesn't shift or change directions, and that I maintain the small of my low back. I'm not hyperextending the leg or hyperextending the low back, but rather when I come back, I can feel that my glute engages while my core is tight. On the way back in, nice and slow. Again, on the other side, in real-time motion, it comes nice and back as my core is tight. I can feel my glute engage at the end, and then I come back to neutral. The progression for this exercise is when we're going to move both the arm and the leg at the same time, the opposite arm and the leg, and how that's going to look while the low back maintains a nice small curve and the core is tight. Arm and leg opposite, little pause at the end, and back in. And without losing that neutral low back, and that neutral spine, out and back in. It is quite a tough exercise for beginners, but something even like to recommend with people who I've been seeing for a long time and who have excellent core strength. You can do some other modifications where you add in resistance bands or crunches in with it, and we can talk about those in a later video, but a fantastic exercise to strengthen the low back and the thoracic paraspinal muscles as well.